Our story begins on a day in February 2012. Dr. John Harding was on call at Lewis Gale Medical Center in the obstetrics unit in Salem, Virginia, and a patient that he knew came in. She was bleeding, she was in pain, she had a very dangerous medical condition that can be fatal for both mother and child. Dr. Harding and his colleague took this woman into one of the operating rooms, and he said that he knew as soon as they got in the room that the only chance this baby had at surviving was to get to a neonatal intensive care facility as quickly as possible. Now, there isn't one of those at Lewis Gale Hospital, and the reason is that the state government had told Lewis Gale that they weren't allowed to build a neonatal intensive care unit because the other hospital in the next town over opposed their application, opposed the potential for more competition for their own neonatal intensive care unit. And unfortunately, the baby at Lewis Gale didn't make it.
The application that Lewis Gale Medical Center filed was for a certificate of need. Certificates of need have no relation to health or safety. They simply dictate who can offer new medical services in a given area. The medical provider has to prove to the government that there is a need for those services. These laws were originally intended to control healthcare costs. But over 30 years ago, the federal government realized that certificates of need do not reduce healthcare costs, and it eliminated all federal funding for them. Virginia isn't the only state to require a certificate of need. 34 states still have some kind of certificate of need requirement. And these requirements stifle medical entrepreneurs who want to offer increased patient access to affordable medical care. One of these entrepreneurs is Dr. Birchansky, an ophthalmologist from Cedar Rapids, Iowa.
When I came to Cedar Rapids back in 1991, I wanted to bring latest technologies and services available for my patients. The thing that Cedar Rapids was lacking was outpatient surgical facility adjacent to an ophthalmology practice. And in 1998, I would build a new building that would have my medical practice on one side and an outpatient surgical facility on the other side. And the only way to get that up and running is to apply for a certificate of need. So I applied and I was denied due to hospital opposition. Shortly thereafter, I applied again and was denied. About 4 or 5 years later, I applied for a certificate of need and was denied. I gave up after that. Now, hospitals are able to open an outpatient surgical facility without going through the certificate of need process because there's a loophole that allows them to do so. And what was more disappointing is that I'm denied, and then they go ahead and build additional operating rooms. Certificate of need is mainly in place to protect the existing facilities from competition. The outpatient surgical facility has been vacant for many years now. It's ridiculous that I have a cataract surgery center that's already built, already equipped, all ready to go, and I've applied for a certificate of need 4 times, been denied every single time because the opposition does not want competition.
Dr. Birchansky is teaming up with the Institute for Justice to file a federal lawsuit to protect his right to offer innovative, safer, and less costly medical procedures to Iowa patients.
Absolutely, I should have the right to do cataract surgery in my own facility, and my patients should not be denied a more convenient, more cost-effective setting.